I think we will start now. 21 participants. Assalamu alaikum. Greetings and warm welcome to the monthly webinar brought to you by the IPH, the Institute of Public Health. My name is Fatima Mazhel. I'm a graduate of the doctorate program from the IPH, so I'm part of the family. And now I'm a postdoctoral research associate at NYU Abu Dhabi. And I'm honored to be a part of this webinar today. The Institute of Public Health at the College of Medicine and Health Sciences is committed to providing a platform for continuous knowledge and exchange, networking and professional development through these interactive sessions. This season is part of the global initiative titled This is Public Health, which is dedicated to highlighting critical public health matters. We are honored to have affiliations with the Association of Schools of Public Health in the European region, also known as ASPHER. And before we proceed, a few housekeeping notes. Feel free to engage by asking questions throughout the webinar. Simply just click on the Q&A option at the bottom center of your screen. This webinar is being recorded and will be available at the IPH's YouTube channel along the past webinars. I am pleased to announce that this webinar is accredited by UAU as 1 CME. Following this session, you will find a link to chat, a link in the chat to evaluate the webinar. Your feedback is highly invaluable, and upon completion of this evaluation, you will receive the CME certificate. Now it is with great pleasure that I introduce today's esteemed speaker, Dr. Rok Hrzic. Dr. Rok is an assistant professor at the Department of International Health at Maastricht University. He holds degrees in medicine, epidemiology, and governance and leadership in European public health. He completed his doctoral thesis on the role of European Union enlargement in mortality convergence across Europe at the International Max Planck Research School on Population Health and Data Science. His research focuses on the determinants of geographic mortality disparities in Europe. His projects include evaluating treatable mortality in cross-country health systems performance assessment, surveying real-world data used in health policy, and utilizing electronic patient records and insurance claims in rare disease epidemiology. He is the founding chair of the Digital Public Health Task Force at ASPHER, where he spearheads his efforts to include digital competencies in public health curricula. The title of the presentation today is Preparing the Public Health Workforce for Digital Transformations. Dr. Rok, it's an honor to have you here with us today. The virtual floor is yours.
Thank you very much for this very kind introduction. I hope you can hear me well, see me well as see the slides on the screen. It's a great pleasure to speak to all of you about something that I'm very passionate about. As you can see, my research really focuses on quantitative modeling and using data to its fullest potential to try to understand how to improve health outcomes, how to improve and evaluate health systems, and so on. And for this reason, I feel that preparing the future workforce for all of the changes that are currently happening in terms of digital transformation is really essential, right? We have to be prepared with knowledge, with skills, to seize all of the opportunities that are afforded to us by the emerging technologies. Now, in the next 40 minutes or so, I'll try to cover 3 things. But of course, I'm very happy to later on also engage with you in a discussion on any of the topics that might interest you or any questions that might be triggered during my presentation. So first, I'll start with the question of how digital technologies are changing the way that we work in public health. We know that from disease surveillance to health promotion, there's plenty of opportunities afforded to us through digital technologies, but there's also additional and new challenges that are created through digitalization and digital transformation. Second, I'll go into why it's so essential for all of us public health professionals to develop robust digital competencies. So while it's very important that we have programs focused on things like digital transformations in healthcare, digital public health, and so on, I think this is an excellent start, and it produces a lot of workforce that are the tip of the spear when it comes to digital transformations. However, to really get all of the potential that's possible out of it, it's essential for us to also bring in digital competencies in general public health education, as well as continuous professional development in public health. And I'll touch upon that a little bit later. Finally, I'll talk about some of the challenges of training our workforce in digital skills. I'll also close with discussing ASPHER's efforts to support training in digital competencies for public health across Europe. So with that being said, let's begin. Now, of course, on this slide, you see kind of this image of disruption. And I think this is how many of us feel, or at least felt, when we started in this area. There's a deluge of information. There's a lot of excitement. There's a lot of energy also in this space. But I think it's important for us to not just be swept away by the wave, but try to surf the wave, right? Try to use this energy. Now, WHO's global strategy on digital health outlines a very nice vision of future health systems. So they envision that data from hospitals, laboratories, wearable devices, and other sources will be integrated and then continuously analyzed to offer us real-time snapshots of population health and allow us to detect emerging disease outbreaks faster and with greater precision, as well as monitor how well we are doing in managing health. Then we'll be able to leverage digital tools to quickly find solutions, adapt them to different population groups, and implement them at scale. So what's important to note here is that this vision of digital public health and digital healthcare is no longer just a futuristic idea. It already exists in certain pockets of healthcare as well as public health. Just as an example, a recent report by McKinsey, the consultancy, looked at case studies of the use of generative artificial intelligence in public health organizations and institutes. And they came up with three kind of main use cases. So first, there's already examples of public health institutes using generative AI to automate report generation, to create tailored information products, as well as to address different audiences and create chatbots. Second use case was in research and data analysis. So these institutions are using AI, generative AI, to synthesize large amounts of information from either scientific publications or even electronic patient records, helping them identify knowledge gaps, save time writing or rewriting grants, or highlight concerning patterns in hospital admissions documentation. And then finally, there's a lot of documented use of generative AI to generate and maintain code bases, right? So that makes routine data analysis, so the kind of work that I do, for example, much quicker and accessible to many more people. And I think that's really an essential use of this technology. Now, the experience of the COVID-19 pandemic a few years ago also provided us with a very visceral understanding of why digital transformations are so essential and necessary for the future of public health. On the slide, you see a case study of healthcare transformation in Catalonia during the height of the pandemic, which emphasizes following transitions that had to happen almost immediately to maintain effective public health services. So the team says that they had to very rapidly integrate and analyze data. So they had to use real-time data from multiple sources to improve situational awareness and enable faster evidence-based decision-making. The team or the authors say that they really had to enhance communication and coordination. So they were kind of primed to build and use digital dashboards, to create online collaboration platforms and automate reporting systems. And thirdly, the authors emphasize the need for them to adapt to evolving challenges. I think we can all relate to this. And they really say that they had to demonstrate a lot of personal and organizational agility to coordinate the multifaceted response strategy that the pandemic really required. So all of this requires a transformation, not only in how we perceive public health and its operations, but also a whole new set of skills. And I'll get to the specific skills that we have in mind here in a little while. Now, in general, what we hope to achieve with digital transformations in public health are three main things, and you see them here on the slide. So first, it's to automate repetitive routine tasks. The second is to speed up as well as tailor communication so that it becomes more effective. And finally, to enable the real-time population health monitoring and prediction, thereby really enabling a much better response time. So in combination, this will help public health professionals spend their time doing more impactful things at a greater scale, and this should increase effectiveness, efficiency, and responsiveness across the entire health system. However, digital transformations in public health also bring about important challenges. So first, there are technological limitations. For example, as useful as AI seems, it's far from perfect. Research has raised concerns regarding data quality, algorithmic biases, and transparency. And for example, there have been issues with decision support systems based on biased data that led to unintentionally reinforcing health disparities in hospital discharges. Second are new digital threats to public health. So just as we, the public health community, can leverage social media and digital platforms to inform the public, so can others with different motives, right? So we can see, for example, influencers that look to make money, or even foreign adversaries looking to create distrust. They have the ability to use the same social media tools and have resulted in a lot of misinformation and the spread of so-called infodemics. And the final challenge that I wanted to highlight is maintaining control over critical digital technologies and infrastructures for public health. We see that we increasingly rely on third-party platforms and proprietary technologies, many of them outside the EU jurisdiction, for example. And this means that outside entities could influence the databases and tools central to public health decision-making. So public health must be part of the broader conversation about digital sovereignty, which means the capacity of nations and organizations to maintain full authority over their digital ecosystems and tools. Now, helping us navigate some of these challenges are two essential principles of digital transformations. So the first one is that digital technologies are a means and not an end in itself. And the second principle is that digital transformations are not just a technical upgrade, but usually mean a change in the way that we do business. So a fundamental transformation of the way that we do things in public health. Now, why do I feel that these two principles are so important? Why do I emphasize them? Well, the first one, about the means and not the ends, the first principle matters because it underscores the importance of digital transformations in public health being steered by us, the public health professionals. So it's, in my opinion, essential for whoever it is that's in charge of digital transformations in public health to understand at a deep level the mission and values of public health. I think this is absolutely crucial and essential if digital transformations is to succeed and if it's to really foster the kind of outcomes and population health benefits that we hope it will bring us. And the second principle, I feel, is an important reminder to stay patient and not to stop too quickly in the transformation process. So not to think that we're done when we aren't. Only digitizing existing processes, for example, instead of making a report manually, just making it automated, for example, but still publishing it just once a year, doesn't really cut it. It leaves on the table crucial opportunities that digital transformations offer. So we really have to change our mentality here, right? Instead of generating reports, why not generate or have available a dashboard where data gets fed into the analytics in real time? That's really a good example of making a true step forward. So let's summarize where we are at this point in the talk. So first, digital technologies can greatly support public health objectives, but they also require rigorous human oversight to ensure that they do not ultimately compromise the public health mission. And for that to happen, it's really on you, on us, the public health professionals, to provide this kind of oversight. because we, I strongly believe, are the only ones who can reflect on, evaluate, help, regulate, as well as implement digital technologies in a way that ultimately creates a more effective, responsive, and equitable public health system. And because it's ultimately up to us to design and build digital public health, it's important that the public health workforce possesses the competencies, so the skills, the attitudes, and the knowledge necessary to appropriately control and use digital technologies instead of the technology controlling us. Now, it's not only me, some assistant professor saying this. In the last few months, the World Health Organization and other organizations released reports that emphasize the critical role of workforce development in the digital transformations in health, not only in public health, but also in the broader health sector. So as an example, WHO's global strategy on digital health, which I mentioned before, calls for, and I quote, expanding the digitally capable health workforce. And it calls for investing in education and training. It urges countries to assess the needs of the health workforce and the impacts of digital transformations on the health labor market. WHO Global also convened an expert group to work on a competencies framework across all health professions. Second example here is an OECD report, which also argues that while digital technologies offer unique opportunities to strengthen health systems, their transformative potential depends on the health workers' ability to put these tools to productive use. And I think that makes a lot of sense. And to do that, the report recommends governments provide political leadership, as well as implement policy actions that are focused on building trust in digital transformation among health workers and patients, advancing the expertise and skills needed for effective use of digital health technologies, and finally, adapting the organization of service delivery along with the related legal and financial frameworks. And finally, we have a report by WHO's Science Council on responsible use of digital technologies. One of its 3 sections is dedicated solely to education and training and calls on academic institutions to incorporate digital competencies in curricula for all health professionals. It also asks governments to create credentialing systems to encourage practicing professionals to acquire these skills. So across these examples and many others, there's a couple of conclusions or observations we can draw. So first, workforce and upskilling and education and training with digital skills have now reached the level of a political priority. And I think that's a very good development. Second, we've recognized that there's a need to invest in this and really provide the workforce with an opportunity to actually upskill. And finally, that there's a role for specialized master's and bachelor's programs, and it's a very important role, but it's insufficient when we have a look at the broader workforce that needs these digital skills and competencies. Now, I wanted to highlight this excellent report by the observatory. It essentially shows us that Europe's health workforce faces pronounced gaps in digital skills. And this is really limiting our ability to use data for surveillance, for health promotion, and policy planning. Now, what is so essential in this report is that it identifies the barriers and facilitators of upskilling at different levels. But what I found personally very important is that it identified some of the systemic problems, right? Some of the systemic challenges, as well as recommendations for providing solutions at the systems level. So some systemic drivers of this problem include fragmented digital infrastructures across different regions, across different ministries, which hinders transferable skill acquisition. Second was a lack of mandated training in both pre-service and continuing professional development curricula. The third one was high workloads and staff shortages, which leaves very little protected time for upskilling. And I think we can all relate to this. At the same time as we're supposed to provide patient care, or we're supposed to provide excellent education, we're also supposed to now suddenly spend a significant amount of time developing ourselves and our skill sets. Of course, we've always done that, but now with the digital transformations, I think the pace of change and the amount of new skills that we're supposed to acquire presents a fundamentally new challenge. And the final systemic driver from the report is an over reliance on speech language courses, which may limit access in many of the member states that participated in this report. Now, of course, there's some recommended solutions here as well. The first one was to embed digital public health competencies in core curricula and licensing requirements. There's an example of France that has done this, and I'll explain it a little bit later. Second is to develop national strategies that unite ministries of health, ministries of education, and ministries of finance behind a clear vision for digital upskilling with appropriate budgets and a designated coordinating strategy or a coordinating body that will oversee this. Third was to fund accessible national language training, so both online and in person, and for this training to be tied to continuous education credits and career incentives. The fourth was to leverage EU leadership in examples such as Pact for Skills or Health Data Space to support multilingual open access courses in public health informatics and data science. And finally, to ensure that there's protected time available for learning by reforming workforce planning, for example, to address shortages and embed training within regular work schedules. Now, this report really focuses on Europe. However, a similar result is highlighted by WHO's Global Digital Health Monitor survey. This report provides a snapshot of digital health maturity across almost 50 countries globally, and it evaluates progress across several e-health domains, and one of these domains is the workforce domain. Now, each country, just to help you parse this plot a bit, each country is assigned to one of 5 maturity phases based on how many benchmarks it meets in each of the domains. And the results are presented here, right, with these kind of scores. What's very important for me to highlight here and to note is that it seems that globally also, we seem to be performing the worst in the workforce domain. So there's a shortage of health professionals with training in the use of digital technology that continues to hinder the expansion of digital health systems. And there's over 60% of countries that were included in the survey globally still in phases 1 or 2, which indicates minimal workforce readiness. So this is not only a European challenge, it's a global challenge. Now, the workforce indicator, if we drill down a bit, reflects 2 specific things. First, the integration of digital health in pre-service training, and the second, the existence of defined career pathways for those digital health professionals in the public sector. Now, what the report finds is that very few of the responding countries reported having fully established pre-service and in-service digital health training curricula. And this leaves most healthcare workers without the necessary skills to support digital transformation. And in addition to this, they found a lack of formalized career pathways, which further exacerbates the challenge because many countries therefore struggle to retain and develop a sustainable digital health workforce. And of course, this is again a general health perspective, but it's very much likely applicable to public health services and workforce as well. Now, let me give you one concrete example, because now I talked about digital transformation and digital skills in quite a vague way. So let's look at, for example, integrating artificial intelligence into public health services. There's a clear recognition that beyond clinical care, AI is driving innovation in public health. And many believe that AI could help tackle pressing challenges by enabling more predictive and data-driven approaches to providing public health services and informing decision-making. However, AI is only as powerful as the data it learns from. Yet, many public health agencies still wrestle with fragmented databases and inconsistent data quality, as well as ensuring secure access to sensitive data, right? This seems like a systemic problem. However, behind the system is somewhat often a lack of also human resource preparedness and training. Second, when we entrust algorithms with life and death decisions, like prioritizing patients for care or detecting emerging outbreaks, we cannot compromise on transparency, fairness, or rigorous validation. The EU's AI Act labels most human health applications as high-risk applications, and this demands very robust risk management and human oversight, again, presenting a new challenge for those of us working in public health that would like to integrate more AI into our work. Finally, AI is a very complex and rapidly developing technology, and to use it at its full potential, as well as avoiding some of the risks that I mentioned, it's essential to have a good foundation of how AI algorithms work, what their limitations are, what to really look out for, and so on. And navigating all of this is a very tall ask, is a very, very challenging task for most of us, because it requires us to develop a high level of skill set across many, many domains. Some of them very proximal to public health and our prior training, but some of them quite distal, right? For example, I don't know how many of you had any training on, let's say, sophisticated machine learning algorithms or the management of health data and health information systems and so on. But these are now really becoming essential skills if we are going to integrate AI into public health services. Now, unfortunately, both in Europe as well as other parts of the world, we're facing a shortage of AI-capable public health workers. Because if you do possess these skills, right, at a high level, it's often the case that the private sector draws away much of the available talent. So we need to acknowledge that for a person with the necessary skills to work with AI in the public health sector, we may not currently offer sufficient incentives to retain them in the public sector institutions, such as public health institutes. And this is one of the challenges that we have to resolve. Now, what happens if we fail to resolve these challenges and fail to achieve these digital competencies as a group, right, as a workforce? The experience in other industries shows that undergoing digital transformations, those who fail to adapt to these changes are often left reacting rather than leading. And in short, that means that we would allow others with more technical expertise, for example, to make key decisions for us. Now, I don't know about you, but I don't see this as a good long-term solution for our sector, right, for public health. I don't want essential digital public health infrastructure and services to depend on tech consultants who have perhaps a limited understanding of the mission and values of public health. So it's essential that we retain this, but for us to retain this, we need to develop the skill set. Now, there's some examples of promising developments in health and healthcare. So for example, in March 24, the EU adopted Commission Delegated Directive 24/782, which modernized minimum training standards for nurses, dental practitioners, and pharmacists by embedding digital skills into their core curricula. Second example is the BUL Skills Monitor, which provides an overview of continuing professional development courses in green and digital skills. And an initial mapping exercise across EU countries and the UK identified that 33 such courses already exist, mostly run by universities, ministries, or health providers. And finally, as promised, there's the example of France and the French Digital Health Acceleration Strategy, which introduced legislation to embed digital skills training into health curricula, guided by a common framework of 5 competence areas. These include health data, cybersecurity, communication, digital health tools, and telehealth. And going forward, health professions education must implement these courses. And the goal is for all health sector learners to complete digital health training by 2027. To support the rollout of the strategy, France has allocated more than 100 million euros and developed a platform so that health professionals can evaluate as well as certify their digital competence across these 5 domains. Now, let me transition to what I see as an important role for the schools of public health, as well as what ASPHER is doing to kind of support the solution of these large challenges that are presented. So first, the schools of public health can support embedding digital competencies in core curricula. We must find ways of integrating data literacy, health informatics, and AI ethics, among other examples, throughout our degree programs, right? To ensure that all graduates of our schools possess foundational digital skills. In addition to this, we must find ways of delivering flexible, lifelong learning opportunities, so continuous professional development opportunities. And finally, we must find ways of forging strategic partnerships. That could be by collaborating with public health agencies, technology companies, technology providers, policy bodies. We really must co-create practice-oriented training and pilot new digital schools and inform policies on data governance and workforce frameworks. And I do think that we have the capacity to achieve all of this. Now, as just one small sliver of this and one enabling factor in the mission of schools of public health to achieve this, it's important for us to understand what do we mean by digital competencies? What are digital skills? This is the fundamental question that needs to be answered. Now, for a lot of other professions, this question has been to some extent already answered, right? So we know, for example, what digital competencies might mean for medical professionals, because there was a recently published framework on it, the so-called DECODE framework, which highlighted competencies in professionalism, in patient and population digital health, in health information systems, and in health data science. However, for public health, the development of similar competency frameworks is still ongoing. Now, on the slide here, which I admit is a pretty busy slide, you see an example of a framework developed for the Canadian public health context. Now, ASPHER and UFA, we're currently collaborating on developing one for the European context, inspired by all the work that's been done to date. And hopefully by this time next year, we will have evidence-based guidelines, so a competency framework that will be able to inform curriculum reform across all general public health courses in Europe and perhaps beyond Europe. Now, the second step, of course, is once we know and have a validated definition of digital skills for public health, how do we ensure that it doesn't become a piece of paper that gets stuck in a drawer? Because we know from past experience that changing public health education and training is very challenging. There's personnel barriers, limited digital competence among ourselves, the teaching staff, limited time to redesign materials. There's organizational barriers, such as limited digital infrastructure or limited funding. And then finally, there are system-wide barriers as well. And we already touched on some of those. But here is where ASPHER comes in. 2 years ago, we founded the Digital Public Health Task Force, which I have the privilege of chairing. And let me tell you, it's a phenomenal experience to work with professionals as passionate as I am about this topic, all across Europe as well as beyond Europe. Now, let me give you some examples in closing of what we do. We're currently conducting a study among our 130 plus member schools that examine barriers to incorporating digital competencies across public health curricula. We'll examine both barriers to deploying new master programs that focus on digital transitions in health, as well as reimagining legacy public health programs for the digital era. And I'm very pleased to say that Dr. Azhar Talal here with us is really spearheading this effort, and I'm very proud to work with her. We also provide a platform for organizations and individuals working on digital public health education to connect and exchange experience, as well as best practices. We've started an effort to examine existing education and credentials in the area of digital skills, building on the work of the Be Well project. And finally, my colleagues have spent the last years mapping the contents of public health curricula across the continent, not just in digital skills, but also across other areas of public health. And we hope to make this accessible as a resource for everyone publicly online. So to conclude, we know that digital technologies are changing public health, we know that public health workforce needs to adapt and develop digital competencies if we are to stay in control of digital public health and use it to benefit our populations. And we've looked at what these digital competencies might be and what we at ASPHER and others are doing to implement them across public health education and training. So we know where we are, we have a good sense where we need to go, and now all that remains is the journey. And if you're interested in being part of this journey, we would love to have you join us. We at the Digital Public Health Task Force in ASPHER, we're a passionate group of public health teachers and practitioners. We deal with the topics that I mentioned today on a daily basis. We also have monthly meetings to support each other, share experiences, resources, and collaborate on projects. And on this slide, you see a QR code with a simple form to get in touch and perhaps join the task force. And with this, thank you very much for your time and attention. And I'm very, very happy to engage you in a discussion.
Thank you very much, Dr. Rok, for a very interesting and very thoughtful, inspiring presentation. It helped shed a light on the potential of digital tools in public health. I'll start. I mean, you spoke about Europe's progress in digital public health. How transferable do you think are these approaches to other regions? And what are the common and practical challenges that arise when implementing them globally?
Indeed, I think that's an essential question, right? Because on the one hand, we share a lot of the challenges when it comes to digital transformation. I think we all share the problem of trying to keep up with the technology. The technology itself is global, it's a global phenomenon. I think a lot of the challenges specifically to implementing digital tools into public health services are also shared challenges. So on the one hand, I think it's easy for us to try to find, joint solutions as well. For example, develop common competency frameworks like the WHO Global is trying to do. But on the other hand, I think it's still essential for us to keep the local, the national, the regional context in mind. There are some specificities there that can't be simply, painted across with a broad brush, right? It doesn't make sense for all of us to have exactly the same training, just as we don't have exactly the same public health services because our populations don't have the same needs. So I think we have to still find a very good balance between working together, of course, learning from each other's experience, but then when it comes to implementation and implementation challenges and how to cope with this in our context, to try to really work with local stakeholders and try to take the local context into account as much as possible.
Yeah, right. Thank you. Anyone has a question or comment? All right. You touched upon AI, and it's where everything is headed towards, and this includes health. And I come from a research focusing on cardiometabolic health and preventive strategies. In your view, which areas of public health stand to benefit the most from AI integration? Is it surveillance, prevention, or service delivery? What do you think?
Yeah, I think that's a very interesting question. My initial sort of thought would be that we'll have benefits across all different domains, of course, right? Like I gave examples already in surveillance, for example, AI, including generative AI, can help us analyze data, can help us cope with large amounts of data that we're seeing now. As long as we manage to set up our health information systems in a way that we can combine these data for these data to be interoperable and for us to be able to access them safely and securely for research purposes. I think using AI tools to support data analytics will be very helpful in surveillance, say. But then also, if you look at things like health promotion, health protection activities, I think we can all agree that AI can really help us tailor communication, to some extent, right? I think this still remains challenging. How to use AI tools, for example, to um, localize communication strategies, or to perhaps simplify some research results, but in a way that we don't lose the gist of them, and these kinds of things. So it's hard for me to point to some concrete examples where this is already happening. I'm sure that members of the audience might have more experience with this because, you know, this might be their discipline. But I think in general, what is really important is that those who will build these tools, those who will develop, let's say, protocols for using generative AI or other AI tools for using public health, that those people have a public health background, because we understand what are the challenges in surveillance, for example, and what are some of the caveats, or we understand why it's so difficult for us to prepare communication strategies for different population groups and how to reach them and what works and what doesn't. So I think that's why I continue advocating for not allowing, let's say, technologists and perhaps just the ICT professionals to develop AI applications for public health use, but for us to upskill ourselves and to become much more active in the process of developing these tools, in advising or co-developing them ourselves.
Right. Right. We have a question from Sheikh. Thank you for the talk. And how do you see the role of public health schools in navigating public health practice environment to enable relevant changes to the curricula and ensure the graduates can put learned digital competencies into practice and professional duties?
Yeah, I think that's an excellent question as well. So in my view, as I mentioned as well, the schools have really three important roles to play here. The first one is indeed, like the question suggests, to update curricula, right? I think a lot of schools of public health across the continent, but also globally, um, very quickly developed specialized programs, right? Like a master's degree in digital transformations in healthcare, for example, or a data science in health course, or a digital epidemiology course, something like that. And I think those are really very important, right? Because we need those, let's say, early adopters. We need people that can go into the hospital tomorrow and help them start organizing processes around these digital tools and getting some of these early opportunities. However, I think where the bigger challenge perhaps lies for many of us is in taking, you know, our legacy programs, you know, the usual MPH program or a usual Bachelor in Public Health program, and looking very broadly at our curriculum and seeing where is it that in my epidemiology course, in my health economics course, in my health promotion course, where is it that I introduce digital skills and competencies so that every graduate of my school has these skills going forward, right? So that they can be effective in 5 years or in 10 years and so on. So I think that's where the challenge is, and that's where it's really essential for us to do the work. Now, in addition to this, I think professional development as well. I think as we develop these specialized courses and as we revamp our more general courses, we'll also be in an excellent position to offer continuous professional development courses in digital skills to the already existing public health workforce, right? You know, people that graduated 10 years ago or so from their MPH, like I did, you know, we're essentially just beginning kind of the middle of our career. This is where we're asked to make our biggest impact. So I think it's very important for us to have the ability to get access to kind of the cutting edge knowledge and to really upskill ourselves. So this is, I think, where some of the low-lying fruits lie. And of course, schools of public health also have a lot of research expertise, right? So this is where we can do a lot in terms of making sure that the competency development, the competency framework development is really evidence-based, is um, localized appropriately, but also draws on general global expertise, that we perform studies of implementation, for example, that we do needs assessments among our workforce. So there's a strong research component here as well that the schools of public health could contribute to.
Yeah. Another question from Elena. She's asking, are there important news related to digital transformation, including the use of AI in health systems from the 78th World Health Assembly that was held last week in Geneva?
I'm sure that there are some. I wasn't in the position because I wasn't in the office to really follow that very closely, but perhaps in the chat you can inform us to some extent. Sorry, I can be more helpful here.
Another question was, how can we protect our patients' privacy and information once we are using AI?
Yeah, I think
Is
that's a very essential question, right?
yeah.
At least in the EU context, this is a huge concern. So promoting, on the one hand, innovation and implementation of AI as broadly as we can, but on the other hand, also navigating some of these security and privacy concerns. I think the best way to do this is to continue engaging with the regulatory process as it is. Of course, there's many flaws there that many experts have pointed out, but I think there's also very important strengths in the way that the EU is approaching this, kind of being relatively cautious, because especially when it comes to healthcare, it might behoove us to move with slightly more caution than in many other sectors, because nevertheless, we are dealing with data that are extremely sensitive, and any breaches of trust here can damage our progress for years to come, if not decades to come. So practically, I think an essential way to navigate this is for more public health professionals, right? Public health experts, either in public health ethics or public health law or other disciplines, to engage with the regulatory process as much as possible, as well as to work with those that are developing AI algorithms and tools for deployment in both healthcare organizations as well as public health institutions, right? I think it's important that we're there actively at the table when these opportunities are developed and deployed.
Right. Thank you. Another question was, what are the best practices for optimizing digital communication to reach all the segments of the community?
That is another excellent question. I don't think that we have a lot of best practices yet. I think in a lot of parts of the world, we are really dealing with kind of the first attempts to use AI or digital technologies to try to reach, let's say, underserved communities or communities um, that perhaps haven't been served very well by us in the past. And I think also it will depend very much on the local context, right? So why is it that these communities were underserved, or why is it that these communities might have worse population health than the majority population? So it's very hard for me to speak about with a very kind of broad brush about best practices that can be applied in any context, right? I think what is essential is to co-design communication strategies, even if they are digitally designed or even if they are enabled by generative AI. So I think it's essential to have members of this community with you on research projects, to include them in all stages of designing these types of interventions or research about them. And I think that will really help you kind of develop not only strategies, either digitally enabled or not, to effectively communicate with them, but also if you then later on go on to develop tools or Gen AI tools or something like that that can streamline or speed up the generation of these communication tools and strategies, to also bring them on board and learn from them. I think the biggest mistake that we can do in terms of public health communication is to pretend that we know best and that we know all the needs and all the concerns of the communities that we serve. And I think that's why it's so essential to bring them on board, to work closely with them, especially when it comes to health communication.
Right. It's still a growing field, so we're still trying here and there. Another comment from Tasneem. Thank you for the wonderful talk. Her question is, are there concerns for the scale to tip in the other direction, in which AI integration leads to digital dependence and perhaps negatively influence the non-digital competencies of professionals?
Yeah, absolutely. I think we see a lot of these concerns, whether founded or not. I think that's a big question, right? I haven't seen a lot of high quality research that would show, for example, that recent medical graduates or recent graduates that grew up in the ChatGPT era, that they would have worse skill sets than others. I'm not aware of such research. Perhaps some of you in the audience are, and I would be interested to learn from you. So please do feel free to reach out later on to correct me. But so far, I think the jury is still out. But I think, nevertheless, we have to take these concerns seriously, right? We have to make sure that our graduates, both in medical degrees and in public health programs, they retain critical thinking skills, that they retain communication skills, that they retain the ability to, for example, devise data analytics code, etc., right? So that they can really use AI tools, especially generative AI tools, as a complement to their skills, or maybe as a multiplier to their impact, and not rely on it to kind of solve gaps in knowledge and these kind of things. So
Right.
here, I think an important role for the schools of public health is to really consider how do we best integrate AI tools into our education. What kind of guardrails, if any, can be put into place? We're recently, so my team at the International Health Department here at Maastricht, we're currently revising our master program. And the way that we're going about this is to sort of assume that students will try to, or at least very broadly, use generative AI technologies. So we're trying to design assessments around this, right? So that even if students use generative AI to kind of try to answer the questions that we assess them on, that we also complement these assessments with oral defenses or with quizzes that are identity proof. So we try to get more of a 360 perspective on the students and their knowledge and help them with the knowledge gaps. I think that's one approach. And then the second approach is to just be transparent with students about these concerns, right? I think nobody wants to go to a degree program and not learn. I think that there's very few people that exist like this. So fostering a culture of openness, of communication around both the opportunities and dangers of the use of generative AI in education and training, I think that's essential. And to help students incorporate AI in their workflow in a way that's responsible, in a way that's um, kind of mature to the limits of AI, and then help them really use it in a way that supports them as professional and supports their professional development instead of kind of using it as a crutch. Um, Again, as you can tell by my answer, we're still kind of trying to find the correct formula here. I think many of our institutions are.
Mhm.
But I'm glad to sort of see that um, through experimentation, we're really in a position to learn a lot about this and hopefully not see this kind of pendulum swing in a completely opposite direction where we have kind of a whole generation of people with very poor skills.
Yeah.
I don't see this as a really realistic fear, but I do still maintain the humility to, we have to monitor this very closely and work closely with our students as well to prevent this.
Yeah, I mean, the new generation that's using ChatGPT, I think they're lucky and unlucky at the same time, and we should be cautious with AI.
Yeah, exactly. And from talking to my students as well, I see also kind of an increasing reluctance with some of them to engage with these technologies, right? The same way that we see a sort of tiredness with kind of um, smartphone use or a lot of the social media apps, which also used to be kind of a big fear or a big deal in education, right? But I do think that going forward, professionals will rely to some extent on AI tools, especially for automating some of the more tedious parts of our work, or perhaps to kind of help us be faster in evidence synthesis and these kind of things. And I think that's why it's important for us to experiment, learn from our experience, um, work closely with our students, and then try to find the right balance. But it's hard, to know what the right balance is without trying it. So I would encourage everyone here, if you're in curriculum design, try to experiment a little bit, and I think that's the best way to navigate this challenge going forward.
Yeah. All right, thank you. I want to extend my sincere gratitude to Dr. Rok for accepting our invitation and delivering an outstanding and highly valuable presentation. I also wish to express my thanks to everyone that was involved in making this webinar possible, including the management of our college and UAU. To our audience, thank you for your active participation. Kindly remember to fill out the evaluation that's in the chat to receive your CME certificate. And please stay connected with us on our IPH social media accounts as viewed on the screen, and you can access all webinar recordings on our YouTube channel. We look forward to your participation in our future webinar. Thank you, Dr. Rok. This was really insightful.
Thank you very much for having me. It was a real pleasure.
Take care, everyone. Stay safe and goodbye.
Bye, everyone.